Hi, everybody. Dr. Debunk here, doing another debunk of medical myths, garbage, and crap spread by doctors and other health professionals. So today I'm going to do a very much needed presentation that I've done many times about thyroid hormone. But the title of this video is, Why Are You Fat and Tired? Do you know that 50% of Americans complain of being fat and tired? 75% of Americans need to lose weight. And the main connection to all this is low thyroid. Um, Energy and weight are very much interconnected. This tiredness thing and fat thing is really about lifestyle and metabolism more than anything. And so when you're talking about energy, so we're going to talk about the tiredness part of this. Fatness is related to it, but the main issue with being tired, and 50% of Americans are inappropriately tired, is because they're low in thyroid. And medicine has completely butchered treating hormone replacement therapies, especially thyroid. With age, we all run out of hormones. It's just a matter of when. There's a lot of factors. But needless to say, in America today, it's epidemic. My estimation, by 35 years old, 50% of women need thyroid. And by 45, men catch up. And so that's what we're going to dive into today. Is complex. I'm going to try to do it in 20 minutes. It's really a 2-hour presentation. And that'll eventually be on my website for those of you that are obsessive compulsive with the science, because so am I. And it's good for you to know, but in great detail. We've been debating how to replace hormones for over 40 years. Really got intense about the time I became a doctor in 85. But correct hormone therapy or replacement therapy is what this is really about. And we're going to focus on thyroid today. But the principles I'm going to share with you are true for all hormones, you know. And the biggest problem is we're doctors, and replacing hormones is a natural and good thing, not a disease thing. And doctors, well, we're licensed disease treaters, as I've said in other videos. We go to school and study the early detection of disease and the diagnosing of disease and the treatment of disease. And nowhere in there do you hear anything about health and wellness. Well, having optimal hormone levels is about being optimally healthy, which is outside the scope of medicine. So we approached hormone therapies back in the 60s, starting doing it then, 1960s, as disease-based professionals. So you get a disease-based outcome. And it's complicated because we've started treating thyroid replacement therapies in 1910. We started giving hormone, the same hormone I give many people, thyroid, now in 1910. And we only had symptom analysis then, and without blood tests, you can have problems. And then the blood test came online and screwed it all up because we didn't know what we were looking at. We saw the blood test result and we thought it meant something it didn't mean. And I'll get to all that. And so hormones are key. To understand hormones, they are the powerful bosses of our body. Thyroid is the king of energy. 80% of your perception of energy. Do you feel energetic? Do you feel tired? That comes from your thyroid levels. The adrenals and other aspects of our metabolic systems account for the rest. But it's a big player. Estrogen and progesterone determine the female nature for women. You look and act and feel like a woman. Men, testosterone and adrenals and some growth hormone, dominant hormones there, make us look and feel like a man. And so when we lose those hormones with age, we start to lose those traits. So we're talking about thyroid. So you're talking about energy. What is your mental and physical perception of energy today? And with age, we're going to decrease the optimal production of hormones. We make optimal hormones. Well, the typical person, younger generations are running out quicker. It's becoming epidemic. Young 20-year-olds already becoming low in thyroid. But at some point, my generation conked out with thyroid in the late 50s, early 60s. My parents, probably the last generation, people born from 1900 to 1940-ish, they kind of never ran out of hormones, but they were living in the healthiest time of America. So now it's going to happen to everybody pretty much. Now, there are exceptions, but we don't do anything for health and wellness based on exceptions. It's based on the bulk of the population and what we're facing and what we need to do to be healthy. So, I got to slow down. My wife says I talk too fast. Okay. So, my opinion, based on my observations after treating thousands and thousands of thyroid patients for 20 years, by 35 years old, half of America women need thyroid. By 45, men catch up. And we need it too. I was okay till 58 or something, 60. And then it became painfully obvious to me that I was low in thyroid. But I wouldn't have been, except my main cause was sleep deprivation, which is one of the causes of low hormones. And so the first question I have to answer, that those of you who have science background, is, well, why does a healthy person not make enough hormones anyway? If you're not broken with disease, why won't your body make enough? It's like saying, why doesn't your body make enough oxygen or breathe in enough oxygen today? It'd be like saying, why you need to breathe 14 times a minute at resting respiratory rate, but you're always breathing 10. So you always feel short of breath. Well, we don't do that. We naturally. And our body naturally would make, but we live lifestyles that prohibit the optimal production. And it's a very slight and subtle thing that occurs year after year. And that's why we get low. I mean, if you're 35 years old, ladies, because women have figured this out. If it wasn't for women, we'd all be screwed because doctors would still be doing the same stupid stuff. 5 to 8% of us doctors do it correctly. We get all the results. I mean, and I'll talk to you about that. But the proof in the end that what I'm saying to you is true is results. Because I have 700 patients on thyroid, and many of them come from all over the state or even out of state, and I see them once or twice a year because they can't get the right therapy. And the proof is their energy is restored and they feel great. And I say that to all my thyroid patients. If I don't fix you in 6 to 8 weeks, just fire me. But nobody fires me. And about 5 to 8% of us in medicine do it correctly. So we get all the results. As I've told you, I live in the Central Valley. It's kind of out of order, but I'm giving you the evidence. I live in the Central Valley, and myself and my partner, who I taught to do this in Visalia, we have over 1,000 patients between us. And endocrinologists don't help them. Other doctors don't help them because they're doing the same stupid stuff. And it doesn't get the results. And so people stay tired. They give them crappy thyroid. They don't know how to understand what the purpose of blood tests are. They don't do any symptom analysis. But anyway, but the point is, it works. And it's so easy with thyroid because, when you're tired every afternoon, well, I jumped ahead. So how do you know you're low in thyroid? Well, this is a typical 35-year-old female who comes in my office and says, Doc, what's wrong with me? In the last year, I've gained 20 pounds. I always had great body weight. I'm tired every afternoon. I mean, like clockwork. I'm tired half the mornings. Half the time I wake up and I get going and I'm good. I have to drink a lot more coffee now, sometimes an energy drink. I get brain fog. I turn into a dumb blonde. I'm a professional, Doc. I'm not dumb. It's like, why do I get stupid in the afternoon, but I'm kind of okay in the morning? They say, well, you'd have to exercise more and then you'll feel fine. I can't do it. I exercise. I have to go home and sleep. And those are the dominant symptoms of low thyroid. In fact, a non-diseased person, if that's you, if I just described you, if you have 2 of those 4 or 5 things I said, and you're not broken with disease, the only diagnosis in the universe of humans is low thyroid. There is no other condition that will cause that. 0. There isn't anything else. But you know what's going to happen? You're going to go to your doctor because you've done your homework and you look on the internet, and the internet says you're low in thyroid. You go to like Davis, Harvard, Stanford, and you plug in your symptoms. They have the little computer that analyzes it, and it says low thyroid. And you're like, yes, that's what I thought. And then you go to your doctor, and he does the blood test, and you come back and see him and think he's going to put you on thyroid, and he says, no, you're fine. And every single time you're fine, almost. And I'll get to that. I'll explain why. The reason so many people, even at 35, are running out of hormones, and thyroid conks out first, generally speaking, before all other hormones, we conk out a thyroid. There's about 6 reasons. So see if this fits your life. In modern America, do we get too many days of being anxious? Do we have too much anxiety, too much depression? We eat too many carbs. We don't exercise enough. We don't sleep enough. We're exposed to a massive amount of chemical pollutants from modern technology, and we don't supplement with iodine. Well, that's every American. That's all of us. That, with your genetics, determines when you're going to run out of thyroid. Not if, when. Is it 30, 40, 50? And some of those things we can treat, like iodine deficiency, is part of the cause of low thyroid, but it's not the only thing. And maybe 5% of the time, it's the dominant thing, and I give people the correct high dose amount of iodine, and it fixes them. Why? Well, thyroid is iodine. The hormone is a specific kind of, we'll just say a piece of protein. It's a little protein structure. There's 2 types of thyroid, T3 and T4. And the difference is just one iodine molecule, but it's all built around iodine and the uniqueness of mammals. Only mammals use iodine. And iodine's only found in the ocean. That's it. And so if you don't eat ocean plants like kelp, you won't get enough. What's goofy is the Japanese have gaggles of studies on this for 40 years. Americans get 1/20th of the iodine that a traditional Japanese person gets that lives on the coast and lives on fish and vegetables and kelp. They supplement it. They throw kelp in everything. We're not going to eat it. Kelp tastes like rubber. We're not going to eat it. So we have to supplement. But enough with that. It's the other lifestyle factors working with your metabolism that will determine when you run out. And so what are the signs of low thyroid? Well, I already said those. And so if that's you, and you go to your doctor and you get this answer, you have to go to another doctor. And so the next step in understanding thyroid is kind of the history because of blood testing. So as doctors became more technical and blood test oriented, in the late 1970s, blood tests became commonly used for thyroid. And the science at that time suggested that the blood level of a hormone equaled the tissue level. Guess what? Not even close. There was no relationship at all between the blood level of a hormone and your tissue levels. Now, all the doctors who are looking at this saying I'm crazy, but you don't know your science. We believed it back then, but now we know that hormones are actively pumped into the cells. It's not passive diffusion. You can have massive gradients. You can be very low in your tissues in a hormone and have normal blood levels. And I can't get into the science why, but it's absolutely true. You can, but it's further complicated, but because of the nature of the human body, high hormone levels always show up in the blood, but low doesn't. And so it's fooled doctors for a long time. And it goes like this, to give you a little science. If you're high in thyroid, excuse me, if you're high in thyroid, that means your thyroid gland is overproducing, and that doesn't happen very much anymore. It's rare because we're so unhealthy, we just can't overdrive it anymore. And so it's building up in your blood, and it's oversaturating your tissues, but the body shuts off the absorption. Once your thyroid levels get high enough in your cells, they shut the doors. So now it has nowhere to go, and it sits in your blood. So if I do a blood test, and also because your tissue levels are high, you'll have symptoms of high thyroid, it all matches. And so all these decades has reinforced our belief that all levels of thyroid, high or low, normal, will show up in the blood, but only high does. If you're low or normal, it has no relationship to the tissue levels. And I can give you all the science. It's absolute. It's absolute. But in medicine, we don't want to talk to patients anymore. Because people want to understand why. And I can give someone about a 5-minute understanding of thyroid when they come in for it, and it's good enough. But doctors don't want to spend 5 seconds. And then they don't know. They don't get it. We've all been given the same bad, wrong science, disease-based crap. Because if you're deficient in a hormone, you don't have disease, you have deficiency. Your body is malfunctioning because you don't have enough of the substance. So take enough of the substance. Well, our gland can't do it. You get some benefit from iodine therapy. And then if you can do all the other lifestyle factors, you can improve. If you want to make more hormones, just exercise hard. And I mean hard. Lift weights hard. And weightlifters for 40 years told doctors all you got to do is build muscle mass and you'll increase testosterone production. And doctors said, you're stupid, you're just knucklehead, moron, apes. Guess what? Numerous studies show that's true. So the simplest way to understand something complex, I'll give you one piece of science. This is irrefutable. Why does the blood test not reflect tissue levels? So here's how it works. Your thyroid gland makes thyroid every day. And it secretes most of it in the morning, and then a couple hours before you wake, and then maybe for 5 or 6 hours after that. And there's not a lot of science there, but it makes sense. We need most energy all day, so we secrete all our thyroid into the blood. Your body takes it up, it turns on all the generators, and we have energy. And then the levels are dropping in the blood at night, and we go to sleep and start it all over again. So if you underproduce just a teeny bit of thyroid, it doesn't mean anything in a day or a week, even a year. So it goes like this. The blood test for T3 thyroid, the main thyroid hormone, goes from 2.2 to 4.2. So the test is only specific enough in the 10th column. It can't measure in hundredths column. So if your blood level was 3.79, the test will read 3.8. It's going to round it up and down. 3.55 goes to 3.6, and etc. And so what if you're underproducing just 1/100th of the amount every day? Kind of 1/100th of a percentage. Not exactly that, but in the 100th columns. Well, the test can't read it. So let's say as a lady, you're supposed to be 3.8. That's your perfect production every day. But you make 3.79. Well, that means in 100 days, you're 1% deficient in thyroid in your tissues, because you're underproducing 1/100th of a percent every day, and after 100 days, you're 1% behind in your tissues, because the thyroid gland makes it. It goes into your blood everywhere. It sucks up into your cells. All 40 trillion cells need it. But the brain, the heart, and the muscles are thyroid hogs because they need 85% of all thyroid. So you're now 1% behind a year later. So what? You have 99% of optimal. So your energy is 99% of optimal. But wait, what about in a year where you're 3.65% behind? Well, what about in 2 years, 3 years, 4 years? And so finally the body kind of crashes and cascades down. It's like the energy dam breaks. And so we see people crash over a year. Part of it scientifically is understood, part of it is not. But the net result is the same. 4 to 5 years later, when you start to underproduce 0.01% or 1%, not 0.01, just 1% of thyroid every day, in the end, you're 20% behind at 4 to 5 years. Well, how do you feel when you're 20% behind? Doc, I'm tired every afternoon, sometimes in the morning. I can't exercise. I get brain fog and turn into a dumb blonde. And sleep can get dysregulated too. There's a bunch of little stuff, hair falling out, lower body temperature. But the dominant energy factors, well, how many of you feel that? You are obviously low in thyroid by symptom analysis, but because of what I just said, look what happens. You go to your doctor. Did he do a tissue analysis test on you? Did he draw your blood, or did he stick a 3-inch needle into your leg muscle, take a tissue sample, and measure the fact that you're 20% behind in the muscles of your leg? No, he does a blood test. Well, I just told you, you're on a daily basis at any moment during the day. If I draw your blood, You're only 0.01% behind. Your blood test says 3.79 instead of 3.8. So it just rounds up. It says 3.8. The test is not specific enough to measure a daily deficiency. So the test is irrelevant. Let me say that again. The problem is the cumulative deficit you've built up over years in your tissues, your brain, your heart, and your muscles, the main thyroid consumers. They're 20% behind because of a 5-year underproduction. On any given day when you draw your blood, guess what? It shows a normal test because I didn't jam a 3-inch needle into your leg. Are you going to let me do that? I don't think so. Have we ever done it? And here's the rub for all of you professional doctors, hoo-hoos, endocrinologists. I hope endocrinologists look at this. You're not thinking. You're not thinking about what we're doing here. You know, here's what we're doing. Here is the question. When have we ever done a study that showed that the blood level of a hormone equaled the tissue level? Has medicine, scientific studies in medicine, since the 70s when we had blood, when have we ever done a study that did this? It measured the blood level of a hormone. It got a history from the patient of what your symptoms exactly were, and we did a tissue level. We drew a tissue sample from, say, a leg muscle biopsy. I mean, you could get people to do it if you paid enough money. And we analyzed how much thyroid was in there, and we looked at your current symptoms, listened to them, and did a blood level, and then correlated them. How many times in medicine have we done a study like that? Zero. Not once ever in, what are we up, 60 years now of having laboratory analysis of hormones. It's never been done. You can find no studies ever published on Cochrane or PubMed databases. Zero. It's never been done. And there's a lot of reasons why. Back in the 70s and 80s, when I became a doctor in the 80s, it wasn't like we were trying to be stupid and screw people up. That's not it at all. This is not a conspiracy. It's the science at the time and a lot of other factors. It just created this factoid belief system that was propagated every decade through the medical schools, that the blood level of a hormone equal to tissue level. We don't even have to talk about it anymore. It's absolute. It's not. And so I challenge you to show me a study. I've gone back to 1903 or whatever, before we even had blood tests. You know, it's not real. And so do blood tests then have no purpose? No, they have tremendous purpose. So let's move on. I'm not going to try to convince anyone. I'm tired of endocrinologists and other doctors. They don't want to believe the science that's in front of their face, but this is common sense, and we don't have any of that anymore. And so here's how it works correctly. All of that to get to this. The correct diagnosis of any hormone deficiency can only be done by symptom analysis. By trusting the fact that your brain is a meter that's measuring all of this stuff. The brain secretes hormones that regulate all other hormone outputs. And so if we can trust that fact, and so that means, and because you're in the brain, the part of your laboratory brain, you're consciously connected to it, you feel these things and know these things, and doctors need to trust that. The bulk of patients that come in and say they're tired, which is 1/3 of Americans, and they're addicted to caffeine, it's not because they're hypochondriacs and have nothing better to do than to bug you and me. And so if they have the symptoms, then it most likely means they're low. Well, then we should treat. And you can use the treatment as a diagnostic tool, right? Which is what I do. Sometimes I'm not clear if someone's low in thyroid by their symptoms. I'll give it to them anyway. I'm not giving them a chemotherapy agent. I'm giving them a natural hormone. It's the same stuff your body makes. So who cares if you give them too much? It doesn't hurt them. You know how much thyroid you have to take to be too much? A ton. I purposely give people too much, so-called too much, by the stupid blood test, because at first you are deficient and you need extra to get rid of the deficiency, and then you back them down. So the correct, and that's a whole treatment thing. I can't get into the exact treatment, but that's one of the principles I teach sometimes other doctors that want to learn this, how to do it. And guess what? The outcomes always prove it's true, because see, here's the rub. For those of you that are, so traditional and you can't hear what I'm saying because it's like, no, the Harvard doctors are the only ones that know anything. When they go to the bathroom, sherbet comes out their butts, and we must believe Harvard. But they're the ones who are disease treaters, not health treaters. They don't study health, they study disease. So you're going to need a disease-based hormone result. Anyway, sorry, I'm on my soapbox. So here's how it works. If you're low in thyroid in your tissues, even if your blood test is normal, and I give you thyroid and it fixes you, what is wrong? Is the blood test still right and you're just crazy? No, it means the blood test is erroneous. And that's what doctors 50 years ago began to see. And women, for a lot of reasons, women run out of thyroid before men because they make babies. And babies are parasites, and they suck all your iodine low to start their lives, and then you're more lower in thyroid. So that's why women after 4 babies are universally more tired. Why? Because you're low in thyroid, because you don't have enough iodine to make new thyroid. And it's like, It's science. Anyway, so you'll always see, 95% of the time, when people have symptoms of low thyroid, if a doctor treats them with the right kind of thyroid, they get better and they're fine. And so you have to be treated based on the signs and symptoms, and then we can use blood tests to help with treatment as far as how much do you give. And that's a whole big thing. I'll give you a little bit of it, but see, if you're a non-disease person, we can trust the fact that your body will behave to obtain optimal health, because everything about the body is to fix itself and to get to an optimal health state, not just normal, but optimal. And so if you're low in thyroid and I give it to you, your body will suck it up like candy. Your heart, your brain, and your muscles are like, yeah, give it to me, give it to me. And then once you have enough, the cells of your body will stop absorbing it. They won't overabsorb unless you really have sustained high blood levels, which I think we can back you down before that happens. And so once you have enough, now you feel good, your energy's restored, and then I do your blood test, and guess what? It looks great. So remember what I said in the beginning, that once you have enough thyroid, your body will stop absorbing it. Your cells will block the doors, the transport doors. And so if I'm giving you too much, which I usually do at first because I want to eradicate your deficiency quicker, then your blood level will start to climb. And so I like it when somebody's blood level is a little bit higher than normal, because now what do I know? I know that your body has enough. It doesn't want anymore. So now we dose you down lower, and life is nirvana. You feel good. Your blood tests look good, except for one of the blood tests. And this is, it's a long story. And for those of you that are watching this that have been burned by this, the TSH hormone is the main screening tool we use as doctors, but it's obsolete. I almost never use it. It absolutely is ruining the treatment because of the science. When it came out in the late 70s, we had false beliefs about what TSH represents, and still do to this day. Because when you take both forms of thyroid, T3 and T4, your TSH will always be screwed up. So those of us, the 7-8% of us that do it, we never use it, because it's always misleading. Because once you supplement with external T3, your TSH is wacko. You could take enough extra T3 for a hamster, and it's going to screw up your TSH. So it's obsolete. So don't believe. Well, this is, again, as far as treatment is my opinion. Anyway, so the proof is in the results. Why I have so many hundreds and hundreds of patients that will not see endocrinologists anymore because they won't help them. So once you're taking a hormone, then you can use it in a way. And there's more to treatment than what I just said. I'm just trying to give you a bit of it. Once you're taking it, then you can make your blood and tissue levels be the same. And so it's a great system. There are some oddball thyroid conditions, RT3 syndrome. Other people have uptake problems. There's a number of variabilities of this where blood tests are more important, but they really are of no value. And that's the main thing I wanted to get. They're not valuable because how many of you ladies have been to doctors and you know what low thyroid symptoms are, and that's what you have, and they keep telling you you're fine. And so then, and because there's two forms of thyroid, T3 and T4, it was easy for doctors to use T4, which is Synthroid. And the problem is that the older you get, the more you need T3, and if you don't take any, you're just going to feel tired and yucky again. And the doctor will say your blood tests are fine on the Synthroid you're taking, or the levothyroxine generic name. Sorry. And you feel crappy like you did back in the beginning when you first started, because you need T3. The human body makes 80% levothyroxine, T4, and 20%. And when we're young, we can overdrive levothyroxine into T3, but it doesn't work with age. And so it's another complicating factor. So there's so many problems with thyroid, the management of it, it's complicated. I'm doing the highlights. That's what's made it confusing. That's why doctors still today, 93% or more, do the same stupid thing they were taught, and they get the same stupid no outcome. People are tired and fat, which is how we started this. And part of it's related to having such a low thyroid status. But until this changes. So there's much more to this. But at this point, the whole point of what I'm saying is, if you go look up for yourself what the symptoms are of low thyroid, as I've said many times now, and that's you got to find a doctor that will treat your symptoms and use blood tests to manage your level. Make sure he doesn't give you too much. That's the main tool of blood test. Except for RT3 syndrome, those blood tests are much more essential, but that's a complicated thing I can't get into. And if you do that, you'll do well. But you got to find a doctor to do it. So I live in the Central Valley, and I don't know, there's some doctors that give the better form of thyroid that's a mixture of both T3 and T4. It used to be called Armor, it's still called Armor, but the company sold out. And anyway, but we have various ways to do it. And so bottom line is, you're going to have to find someone. Now, I have to tell you all this little disclaimer. I'm not your doctor. This is all information about what I do with my patients, and I'll stand behind it with anybody. And so will my patients. As far as the outcome, the results, nobody gets too much, they're doing fine. Are there problems with too much thyroid? Yeah, but you got to have a lot, and you got to have pre-existing heart. The only big problem we've ever seen with thyroid when it's excessive is heart. If you have pre-existing irregular heartbeats, too much thyroid will jack you up. It does, but it's so easy not to get there. And so, but you're talking about hormones. I mean, we give people chemotherapy drugs that are maybe going to give them more life and it's killing the cancer cells, but it's wiping you out. We give such toxic drugs and act like it's fine. And then I get creamed by my colleagues because I'm giving somebody a little too much thyroid. And the blood test shows that they have no symptoms, but it's like they act like I'm giving them arsenic or something. It's so absurd, you know. So you have to take all of this with a grain of salt. This is my professional opinion about how I treat my patients. And so since you have to get a prescription for thyroid, you're going to have to go to your doctor and hear what he has to say about it, and you'll have to go under his guidance, because this is all for educational purposes. No different than when a big hoo-hoo doctor from Harvard says, "Well, this is how we treat blood clots in the lungs." Well, he's not treating you, you know. But this is such a big thing because of energy, and everyone's addicted to caffeine. You know why there's a caffeine addiction in America today? Because of low thyroid. You're really low in thyroid, and caffeine's fake thyroid. Caffeine imitates what thyroid does, and that's why the whole country's addicted to it. So I'm going to end it now. This is long, way longer than I thought, 34 minutes. If you're in California, come see me. I don't care if you have to drive 400 miles. I'll fix you. It's so easy. I could teach a medical student in 1 hour how to treat people correctly for thyroid, and he would get better results than all the endocrinologists who's at Davis or Harvard or wherever, because they're doing it all wrong. You know, and the proof is results. The proof is results. Do the patients get their energy restored, and do they have great blood tests? Does their ultrasound look good of their thyroid if you want to do that stuff? You know, absolutely. You know, I've been doing it 20 years, thousands of thyroid patients. So um, come see me, because now with telemedicine being so common, I see people twice a year. If I only treat your thyroid, I just have to see you twice a year, and one time can be a telemedicine visit. But you got to come and see me face to face to be established as my patient. I won't do this initially unless I see you and examine you, know your history, and then. But I don't care. You can even be out of state. I'm just gonna have to connect with you twice a year and get blood tests once a year. Um, and following up, it's necessary because you can take too much thyroid, but you have to take a lot, and you have to take it a long time. And so it is a prescribed treatment protocol that only licensed doctors can do. And so, but it'll fix you. You don't have to be fat and tired. You don't have to be, well, the fatness is, carbs, but most people are anywhere from 5 to 20 pounds lighter when they go from deficient thyroid to optimal, and your energy is great. This works 80+% of the time, just fixing thyroid. There's other factors, like if you're sleep deprived, which is a cause of low thyroid, then thyroid only helps you some, because really you're sleep deprived. Sleep deprivation is wicked. It's one of the 10 factors of human health living. If you want to live a long time, you better sleep. And so, yeah, come see me, make the trek. I have people up and down California, come see me or my partner in Visalia, because it works. And, you're wasting your life by fighting. And people just crash. They can't do it anymore. It seems to me it's catching on more. It's slowly doctors are accepting the truth, what they see with their own eyes. They don't believe what they were taught anymore because they have all these patients. I mean, that's how I got started. Last thing, 20 years ago or whatever, I think I had 5 or 6 women in the same week come in my office with the same low thyroid complaints, classic low thyroid. All their blood tests were fine. And I finally said, wait a second. 3 of these women I've known a long time, and they are smart and professionals. One had a PhD. They're not making this stuff up. And so I treated them anyway. And guess what? It fixed them. And so I was like, and then as a doctor, if you start digging into the secondary studies and the other opinions, you start to realize, oh, there's a whole other way to look at hormones and treating it. It's not what we were taught, at all. And so then you start treating people, and the more you dig, really, the more you realize, oh, what we were doing is all stupid. And you get all the results. Your patients are happy, you're happy. It's like, so that's it. And I have to say again, because this is intense treatment that I just shared with you, this is for educational purposes. If you have to get a doctor to treat you. I don't know if you can get thyroid in Mexico. I hope not. But you need to have a doctor, because it's more complex than everything I just said to you. I tried to summarize it. And yes, you can take too much. But that's it for today. I'm Dr. Debunk. Thanks for listening.